Dr. Katwa here. So there is something I want to tell you guys today. A question that comes up a lot. How does mental illness and physical illness relate to each other? So I'll divide that into three parts. The first part of the relation, I would say, is the obvious part. So this one is not hidden and can be seen. So in this case, physical illness affects mental illnesses in the following ways. Yes. So the first way is that you have a chronic illness. It causes you to have stress. You constantly think about whether you will survive it or not. And it affects you, could lead to anxiety and could lead to depression and other mental health disorders. Another one is that you have maybe a tumor in the brain. The tumor is pressing an important area of your brain. In this case, for mental illness purpose, it presses maybe on the frontal or the temporal areas of your brain and leads to mental health or behavioral symptoms. But now, how does mental health affect physical health in an obvious way? So, you have a mental illness. It gets you to be confused. In that state of confusion, you jump over maybe a fence trying to escape. Maybe you are paranoid. You hurt your leg, you get a fracture. So that is one way. The other way could be, in a state of mental illness, you feel constantly anxious, maybe depressed. And to relieve that anxiety or depression, you take a sip of alcohol. The alcohol leads to addiction. Addiction leads to liver damage. And that liver damage now can be a physical illness that resulted from a mental illness, which is addiction, which could have been caused by other mental illnesses like anxiety. So the second way, I will call it the subtle, like not so obvious, not so hidden. So in this case, you have mental illness. The mental illness causes you to have fear all the time. And that fear causes sympathetic activity. That means your heart to race, your breath to be short, to be hyperventilating, and then you feel maybe chest symptoms or what people call butterfly in the stomach. So you feel abdominal symptoms. So that is mental illness, in this case anxiety disorder, causing you to have physical signs of a physical disease, but really that disease does not exist. So it's just a physical manifestation of mental illness. And how could these physical diseases cause mental illness in a subtle manner? An example is maybe you have electrolyte imbalance. Low sodium can cause depression. And in some cases, people are treated for depression for years, but the problem is low sodium. Maybe I'll blame physicians here because sometimes they tell people to consume low levels of salt as dietary advice for hypertension. And if you take low levels of salt for too long, you may end up getting depressed. Your sodium level goes low, maybe 130 there. And it causes you to have depressive symptoms. And the doctor keeps wondering, why is this patient depressed? That's because they have low levels of sodium. So another case is a thyroid functioning test is abnormal. So if you have an abnormal thyroid function test, either high levels of T3, T4 or low levels of T3, T4 could cause various mental health symptoms. So I would term that as physical illness subtly causing mental health symptoms. Now the third category is the hidden. And now this one, the hidden, is very difficult to determine. So the various ways in which physical problems could cause mental illness in a hidden way, that is very difficult to prove and also very difficult to treat, is that we have some new research showing that intestinal microbiota, that is the microorganisms living in your intestines, could influence your mental illness. So the diversity of your normal flora in your gut, or the various different types of normal flora in your gut, could influence your mental health. And that one is called the gut-brain axis. And it is one of the newest researches going on. And that is why you find some psychiatrists will prescribe to you probiotics for mental illness. Maybe you wonder why. So I would still leave that to be further researched so that we understand it more. In which way could physical illness be caused by mental illness in a hidden manner? So when you're mentally ill, maybe with anxiety, depression, or meaning you have high levels of stress all the time, you have a high level of a molecule in the body called cortisol, and this is a stress hormone. It causes all manner of physical changes in your body that could lead to eventual heart disease, maybe problems with blood pressure, blood sugar control, weight control, so you may get obese, etc. To conclude, mental illness and physical illness are interconnected. I've only dipped the toe into what happens. I've divided it into 3 so that you understand better, and we'll keep discussing more as time goes. Thank you. Enjoy your day.